So, you're a parent of a child with ADHD. You already know it can be a journey filled with a lot of questions, some real frustrations, but also so much love. Well, you're in the right place. We're going to cut through all the noise and give you a clear, supportive guide to what's really going on and how you can actually help. Does this sound at all familiar? You feel like a broken record, right? You sent the texts, you've put a note in their bag, you've reminded them at the door, and still, that assignment is sitting right on the kitchen counter. It is absolutely maddening.
And then, of course, that little voice in your head starts up, doesn't it? You see them struggling, and it is so easy to turn that lens right back on yourself and think, what am I doing wrong? That is such a heavy weight for a parent to carry. Okay, let me be crystal clear about this. You are not alone, and this is not your fault. What you and your child are going through has a name, and even better, it has an explanation. So let's get you out of that place of confusion and guilt and move you toward real understanding and empowerment.
So, to truly help our kids, we have to start by reframing what we think ADHD even is. This isn't just a behavior problem or some kind of character flaw. No. This is about understanding the unique and amazing wiring of your child's brain.
So officially, ADHD is a neurodevelopmental condition, and the key words here are executive functions. I want you to think of executive functions as the CEO of the brain, the part that's in charge of planning, organizing, controlling impulses, and managing emotions. With ADHD, that CEO is just wired differently. It's a biological fact, not a choice.
This two-brain systems analogy is maybe the best way to get it. The focus system is why your kid can get lost in video games or Legos for 3 hours straight. That's hyperfocus, and it works great. But the brake system, the one you need to stop doing something fun and switch to homework or to not blurt something out, that system just isn't as reliable. It's not that they won't use it, it's that their brain has a harder time activating it.
It's also really important to know that ADHD looks different on different kids. You might have a child who is mostly inattentive, kind of the classic daydreamer. Or you might have one who's mainly hyperactive and impulsive. And a lot of kids, well, they have a combination of both.
All right, so how do you get some actual answers? I know the whole process can feel like you're trying to navigate a maze blindfolded. But really, when you boil it down, it's a pretty clear two-part path that's designed to get your child the right support, both medically and in school.
And here they are, the two big evaluations you need to know about. On one side, you have the medical diagnosis. This comes from a child and adolescent psychiatrist, and it's the official clinical piece. On the other side, you have the educational evaluation. This comes from the Guidance and Research Center, or RAM, and its entire focus is on figuring out what your child needs to succeed in school. So the official game plan kind of looks like this. Step 1, you start with the psychiatrist to get that medical diagnosis. Step 2, with that in hand, you get a referral to RAM. Step 3, RAM does their own assessment to figure out the educational side of things. And then, step 4, they create something called a BEP, or an Individualized Education Program. That thing is literally the blueprint for your child's success at school.
And listen, I know so many parents worry about their child being labeled, but I really want you to try and reframe that in your head. A diagnosis and an educational plan are not a stigma, they are tools. They are a key that unlocks protections and resources that guarantee your child's right to the support they need to thrive.
Okay, let's talk treatment. The old days of a one-size-fits-all approach are long gone. Today, all the best evidence-based guidelines point to what's called a multimodal approach. It's just a fancy way of saying we use a bunch of different strategies that all work together.
Think of a really effective treatment plan like a sturdy table with 4 legs. You've got medication prescribed by a psychiatrist, which is often the foundation for managing the core symptoms. Then you add the other legs, behavioral therapy for your child and training for you, that school support plan we just talked about, and of course, a healthy lifestyle. Good food, exercise, and sleep. They are absolutely crucial.
And right here, this is it. This is probably the biggest hurdle for parents. It's the number one fear I hear. If my child takes this medication, are they going to get addicted? And you know what? That is a totally valid and important question to ask.
And the answer from decades of scientific research is a clear, confident no. In fact, the evidence shows the complete opposite is true. Properly treating ADHD with medication under a doctor's care is actually a protective factor. It significantly lowers the risk of substance abuse problems later in life.
And this number right here shows you why.
When ADHD goes untreated, that impulsivity and difficulty with self-regulation can lead people to self-medicate down the road. In fact, people with untreated ADHD are 3 to 4 times more likely to struggle with substance dependency. So you see, treatment isn't the risk. Untreated ADHD is the risk.
So beyond the clinical stuff, so much of managing ADHD is woven right into the fabric of your daily life. The little strategies you use every day at home and the ones you advocate for at school can make a huge, huge difference.
Here are some real game changers. At home, think predictability. Routines, visual charts, simple rules, these things create an external structure that the ADHD brain desperately needs. At school, it's all about collaboration. Talk to the teacher, make sure that BEP is actually being used, and ask for simple things like sitting near the front. And in both places, this is key. Praise the effort, not just the perfect outcome.
Okay, for this last section, let's make a really important shift in our thinking. Because yes, there are challenges, we know that, but that's only half the story. It is just as important, maybe even more important, to recognize and celebrate the incredible strengths that often come with an ADHD brain.
I want you to think of these traits as two sides of the very same coin. That brain that gets distracted easily, that's also the brain that's connecting ideas no one else sees, which leads to amazing creativity. That hyperactivity, that's also incredible energy and enthusiasm. And that impulsivity can look a lot like spontaneity and a willingness to take risks that lead to big rewards.
As we wrap up, I just want to leave you with a couple of final thoughts, and these are for you, the parent. We've all heard this on an airplane, right? But it is honestly the most profound parenting advice there is. You simply cannot pour from an empty cup. Taking care of yourself isn't selfish. It's essential for your child's well-being.
And please, please let this one sink in. Give yourself permission to let go of that impossible pressure to be perfect. Your child doesn't need a parent who gets it right every single time. They need a parent who shows up, who loves them fiercely, and who offers compassion, not just to them, but to yourself too. You are more than good enough.
You see, when you shift your mindset from just managing a deficit to actually nurturing a different kind of mind, a whole new world of possibilities opens up. With real understanding, the right support, and a focus on their amazing strengths, your child won't just get by, they will absolutely thrive, and that journey starts right now.